traffic. My name's Jim Morrill. I'm 48 years old, and I wear the sound lens. I don't know when my hearing loss started. I don't know if it was due to my monthly range for firearms, if it was my SWAT training, possibly my canine partner, Jet, barking in my ear all the time. But it got to the point that it was affecting what I could hear at social gatherings, affected my hearing at home, and definitely at work. As a police officer, it's important that you're able to hear information accurately the first time. When I get radio calls, I was struggling hearing license plates, addresses, suspect information. One call in particular, I was listening to a suspect. He actually made a confession of some sort, and I couldn't accurately hear what he had said. And when I questioned him again, he just stopped. I've had the opportunity to work a lot of different jobs within law enforcement. I've worked SWAT, I've been a canine handler, as well as a patrol officer. There's always been this kind of an embarrassment to show up at work with hearing aids at my age. One of the reasons I chose the Starkey Sound Lens hearing aid was because it's hidden. And I've had many of my partners that I've worked with for months now that don't even know that I'm wearing them. My family, my kids will ask if I have my hearing aids in because they can't see them. My advice for anybody who's thinking about getting hearing aids, who are experiencing hearing loss, is to don't hesitate. There's the stigma of having hearing aids at a younger age, but what I found, what I was losing in my social life and at work, it wasn't worth it. I'm glad I went in, I'm glad what I did, and I'm glad for choosing the Starkey hearing aids.
Hi, it's Dr. Kenny Levine. Welcome back to Health Talk. I'm here with my favorite person relative to my ears, Perrry Giordanelli. Perry, there are many types of different hearing aids available. How do you match the hearing aid with the person?
Hearing aids are a lot like medication. It's not that one hearing aid is universal and it's going to fit for everyone. Unfortunately, I see people who come in and say, my friend has this type of an instrument and I would like to wear this type of a hearing aid. It's kind of like going into a doctor and say, my friend feels a lot better because they take insulin, would you give me insulin? Well, it's only good if you're a diabetic. You may have gout and need a totally different type of a medication. What I try to do is best match the technology of the instrument for the type of hearing loss that the patient has. The configuration of the hearing aid also plays a very important part in the hearing aid. Size, whether it's something that sits behind the ear or something that sits in the ear. Cosmetics people think are tremendously important, and I try to make the cosmetics be second, and I try to make the technology that's going to give them the best hearing that they can be the primary reason for fitting the hearing aids. Unfortunately, we see people who are dragged in by their wife, by their husband, by their kids, and they're pounded to get hearing aids. And no matter what you do for people who don't want to wear hearing aids, it's going to be a battle.
You know, you mentioned your wife and your kids. Before I got the hearing aids that I have, the hearing aids I have, my children said to me, Dad, you need hearing aids. You don't hear. And Linda says, you're not hearing me. And, some people say not hearing your wife is a good thing. In my case, not hearing my wife is not a good thing.
I understand.
So I have to hear everything. You know my wife, so we have to hear everything she says. And for me, it was wonderful. Now, I can tell you that I have dozens of friends, and at least half of them have said to me, if they find out that I have hearing aids, they say, I got to get hearing aids because I don't hear this, I don't hear that, I can't hear the television. My wife tells me I need hearing aids, my kids tell me I need hearing aids. An interesting sidebar is that when I talk with my children now, they said, Dad, speak up, because I can hear myself better. So I talk more softly than I used to speak. I'm not shy, but I talk a lot softer because to me, it's a bigger sound, and I like a bigger sound.
The best critic of a hearing loss is the spouse. Hearing loss happens very slowly. It's kind of like watching your children grow. They don't grow in spurts because you see them each day. But if you don't see your grandchildren, but every 6 months, 8 months, you look and you see the leaps and bounds that they grow by.
Sure.
Our hearing losses happen so slowly, but the people around us are the ones who see it and are aware of it more than anyone else.
You know, we're going to talk a little bit about children and grandchildren in a moment, because my grandson said something very clever to me. This is Dr. Kenny Levine with Health Talk. We'll be back in just a moment. Thank you.